thank you guys for being here today. I'm going to start off by turning it over to Isaac Kabunga. Isaac is Saraphina Bukirwa's brother. And we've got Isaac here. We've also got Aaron with us, who's the person who initially alerted our office to this. But I want to turn it over to Isaac so he can tell you all about what's happening, about the conversations he's had with his sister, and then I'll come back on and talk a little bit more.
Yeah. Thank you all for being here with me. My name is Isaac Kabunga, and I'm a brother to Saraphina Bukira. My sister Saraphina was born with sickle cell anemia, and she's been taking medication. She's been in and out of the hospitals all her life. Last weekend, on Saturday, I had to take her to the hospital because I had to take her to the hospital because she had experienced a crisis. So she was admitted at University of Louisville, and she left. She was discharged on the 21st, and the next day morning she had to go for a sickle cell conference for the Warrior Cons in California. On her way to the airport, I dropped her off and I stayed by the cab to make sure she boards very well, and then she was supposed to give me a call. A few minutes later, she came out with the ICE agents, and I noticed they were putting handcuffs on her. So I stepped out of my vehicle and asked them what was going on. And they said my sister had overstayed her visa, and that's the reason they were arresting her. I rushed to the ICE offices, and when I got there, they handed me her luggage, and they told me that she's going to be transferred to the Grayson County Jail, and she's been there since then. Last night, I spoke with my sister, and her health was deteriorating. She was in pain, and she told me she had chest pain. She had, her voice was very low. She could barely speak. And this morning I received another phone call again from her, and she was telling me like she really needs a hospital. And she said the crisis started from her leg, so she couldn't use one of her legs, and she's in a lot of pain. I rushed, and I was able to go and see her doctor, Dr. Crocker, at the University of Louisville, Brown Cancer, and he was able to write a letter, and I explained to him the symptoms she was experiencing, and he also advised like she needs to seek medical attention. Otherwise, with sickle cell, that can be a life-threatening situation for her. It's a very tough situation for me and my family because she's never experienced something like this before. And at this point, what I care about is her medical attention. If at least she can get the medical attention she needs, then we know she's gonna be okay. But at this moment, it's very difficult, and my family is really facing it. Yeah. I sent an email with the letter I received. I sent an email to one of the jailers explaining exactly what the doctor had wrote in the letter, but up to now I haven't received anything. I haven't got any response from there. And I appreciate this moment because right now the congressman and his team are very supportive at this moment. They are trying the best as they can to make sure she seeks the medical attention, but we have no idea what's going on at this point. Thank you.
First of all, I want to say, Isaac, thank you for your courage, for your advocacy, for being willing to stand up and share a really, really emotional story. I'm going to zoom out for just a second. Saraphina shouldn't be there in the first place. But this isn't theoretical. This isn't in some far-off place. This is one of our neighbors. This is a Louisvillian. Somebody who went to the airport to fly to a conference to help other people with sickle cell anemia, who got taken away from her family and sent to a jail where we don't know that she's getting the medical care she needs to stay alive. This woman has done nothing wrong. She has never been charged with so much as a speeding ticket. She has sickle cell anemia. Isaac told me that she was so sick as a kid and had so many transfusions they had to take her spleen out. She's a fairly recent breast cancer survivor. This is a medically complex case from somebody who went to the airport to go to help other people. She came here legally. She has played by the rules and followed the laws. And she has been taken away from her family down to a jail in Grayson County, Kentucky. Her youngest son turns 2 on Friday of this week. But we're going to fight for his mom's life. We're going to fight for Isaac's sister's life. We are going to fight to make sure that she's okay and this doesn't happen to anyone else. This isn't theoretical. This is happening right here in our backyard. And we're going to do everything we can to make sure that Saraphina is okay. I don't know, do you want to say anything, or we'll open it up to questions at this time. If you guys have any questions for me or for Isaac, anybody up here? Yeah.
I was going to ask Isaac, I'm curious about Saraphina's NGO work in Uganda, I believe, right? Helping others with sickle cell anemia. Can you tell me a little bit more about that? Like, what was she doing with that?
Yeah, so Saraphina, during COVID, she opened up an NGO that's called Saraphina Sickle Cell Society, and it helps people like her, like patients like her who have sickle cell, and she advocates for medication. She does sickle cell tests. Currently, she has a project, and some of the donors are here in the United States, like Sickle Forward, and they launched a project in Uganda that is trying to tackle sickle cell district by district, and they are scanning. It's called a newborn sickle cell screening, and she's been working on that at the same time not being able to be home to be with our project, but to try and get whatever help she can need from the donors in order to help. And also, since I know she's sick, but she's a very hardworking woman and she's very relentless. So she knew, she noticed like a lot of people she speaks with here in the States, they don't know much about sickle cell. Then she decided to to register the NGO here, and just last month she had just received her 501c to carry on our work here in the United States. Yeah.
You said that you were told that she overstayed her visa. Is that true? And what is the protocol, Congressman, for someone who does overstay their visa?
Thanks, Aaron. Speak a little bit about this. We do have a privacy release form on Saraphina. I want to make that clear from the start. We have talked with her family. Some aspects of the case we can't go into, but want to talk about this a little bit. Saraphina came here on a visa to do her sickle cell work in the United States. She then applied for asylum here in the United States, and is doing everything the way that the rules and the laws have been laid out for her to do. So she has a pending asylum claim right now.
For the very early stages of her detainment, but other ICE detainees have filed successfully habeas corpus petitions. Is that something that is in the works to try to get a federal judge to release her?
Yeah, and I'll zoom out a little on this question too. What some of the things our office has been doing. So once we were contacted by Saraphina's friends and family, we immediately have gotten to work on this, and this includes talking with her attorneys. She has multiple immigration attorneys now. I believe that today one of those attorneys has filed a habeas corpus motion, which probably should be in the Western District of Kentucky when completed. There are other things we've been doing as well, and before the family wanted to make this public, some of the stuff we've been doing, our office has personally been in touch with ICE. I have personally been in touch with ICE on this case. We are trying to make sure that Saraphina has the medical care that she needs to stay alive. Isaac mentioned this, I don't know if you guys heard it. She was in the hospital on the 21st of this month. She tried to fly out on the 22nd to a conference to help other people who are also dealing with sickle cell anemia. She battles sickle cell anemia and has her entire life. She is sick. It is a complex medical condition. She needs care. We want to make sure she's getting that care. There are also some disturbing reports we've heard about how she was detained. We've asked for any body camera footage, any video footage from the facility, to make sure that they are not just taking care of her, but they aren't mistreating her. We are working really hard to get the answers to these questions as quickly as we can. We've contacted other members of Congress for help on this. We've contacted DHS, we've contacted ICE, working with the family as well, to try and get the answers that, quite frankly, all of us are owed. Right? I mean, this is one of our neighbors. This is someone who's trying to help other people. This is someone who's come here and done everything the right way. And now we're trying to fight to get her the most basic of medical care. Medical care shouldn't even be there in the first place. So that's kind of what we're doing. We're working with the attorneys in that. Yeah. No.
Is it clear that she's had no medication whatsoever, or just spotty access to medications?
Can we talk about that a little bit, Isaac?
Yeah, can you repeat the question, please?
Yeah, has she had any access at all to her medications, or has it been spotty access, or just no access at all to her medications?
Yeah, so my first visit that I was able to see her was on Sunday. That was on the 26th. And that morning, she told me this is the first time they have given me all my medication. But from Wednesday through the week, she was not getting all her medication, and some of it, if they were to give it to her, they were putting it in water. They were diluting it in water and then giving it to her. So she told me only way she could know if it works. But she had no idea. So.
And how Isaac explained that to me was when they put it, let me say up here, when they put it in the water, she didn't know what she was taking. So she didn't actually see the pills, she didn't see the medication. And so the only way she knew if she got what she needed is if she wasn't feeling terrible, if the medication itself was actually working.
Isaac is here speaking publicly about his sister and his family, but I assume your office is working with so many other people that are not willing to go public. Could you just give us a better sense of the work you're doing, and maybe even, just how many families you're working with?
Yeah. Take this one, Isaac. What the Trump administration is doing is wrong. And I have an amazing team, and we are doing casework every day, every night, to try to help people like Saraphina, people who are our neighbors, people who are doing the right thing, people who've never even been charged with a crime, who are being picked up and taken to places and sitting there for months and months on end. And the stories are heartbreaking, honestly. It's heartbreaking. I've been to some of the detention facilities and sat across from these people, right? people who maybe got the equivalent of a speeding ticket or have no charge at all, haven't seen their family in 9 months. And it's tough. It's tough on the team here. But we're not going to give up because we have to keep fighting.
Congressman, what are you seeing with, and this is going to be a tougher question, but
Yeah.
with some of the conditions that you see in these
Mhm.
detention facilities, is there anything that even like the local administration itself can do, like the Grayson County Detention Center itself, to help out at all?
Yeah, and I appreciate that question. And first and foremost, I want to point out how many people just shouldn't be there. Right? No matter how good a facility is, it's a jail. When you've done nothing wrong and you are picked up and put in a jail, you're in jail. You know, there is no jail in Kentucky that's the Ritz-Carlton. And so, you know, aside from the conditions, that's what strikes you. When you sit down across from somebody who's never been charged with anything, who came here legally, who's doing things the right way, and they are sitting in a jail because of an administration that is hell-bent on persecuting our neighbors. That, I mean, it is tough to comprehend. For the facilities themselves, yeah, there are varying conditions in the facilities. They're run by different people in different places in Kentucky, and when you go to multiple of them, you can kind of compare and contrast the differences in some of them, and some are clearly better than others. But, you know, again, aside from the conditions, I just think about the policy behind a lot of this and how cruel that is.
This may be kind of new information, I don't know, but,
Yeah.
because I know the New York Times just had that piece a day or two ago about
Mhm.
how TSA and ICE are
Mhm.
working together now.
Mhm.
This is the first time I've ever heard of anyone being picked up at SDF by ICE officers. Joe, are we aware, has that been happening? Is that been a situation that's been happening already?
Not that has been reported.
I say, I don't think we're aware of it.
Okay.
I don't want to speak for everybody. You know, I mean, and just, this isn't really off the record. I hope you guys don't lead with this, you know, because I'm just talking, like, one of the things that's tricky about this is we are only alerted when someone tells us, and then can only talk to that person with a privacy release form. We are working really hard to always find out information. We're not just like sitting back and waiting for someone to call. We are actively and aggressively trying to pursue and help people out. But, you know, it is not, so it hasn't been reported to us, but that's all that means. Yeah. Anybody else?
What is your top line message at the end of the day here?
Yeah. This is nauseating. We have a mom. We have a sister. We have a neighbor, a community advocate, someone who's trying to help people deal with sickle cell anemia, a lifelong disease, doing the right thing, never done anything wrong, going to the airport to fly to a conference to help other people in our country, who gets picked up and whisked away and taken down to facility in Grayson County, Kentucky, where we are wondering if she's getting the medical care she deserves. That's what we're here talking about today. And honestly, that should sicken and scare everybody. Appreciate you guys coming out in the afternoon. Thank you all.